Hi, I'm Tim Wiedrich, Section Chief of the Health Resources Response Section with the North Dakota Department of Health. And this is the statewide hospital operations briefing for Friday. Let's head over to Tim Blazel and check in with the Hospital Association and see if Tim has any opening comments.
Hi, good afternoon, Tim. Good afternoon, everyone. The only really opening comments I have is that we're knee-deep in trying to understand the governor's executive budget that was presented at the state capitol yesterday. So I know I was able to attend that event, and I know he thanked everybody for everything that everyone's doing during the pandemic, but he did wish, healthcare workers and first responders. I mean, he did wanted to show his gratitude and thank them for battling the pandemic. And so I think that was great to hear. But, as of right now, we're knee deep in that. And so hopefully there will be more information to come on that. So, Tim, I think those are the only opening comments I have because, obviously we're battling the pandemic, and here in about a month we have a legislative session starting. So, and we're looking forward to that. So those are my opening comments.
All right. Thank you so much, Tim. Well, each week on Friday, Grace joins us for an overview of the hospital intelligence information. And let me check in with Grace, make sure that she's with us. Grace, are you here?
Yes, I am. Hi, Tim.
Hi.
I will just go ahead and share my screen.
Great. Thank you.
If you can confirm when you see it. Do you see my screen?
All right. It's just popping up.
Okay, perfect.
Anytime you're ready.
All right. So I will just pick up where we left off last week. Again, we continue on this downward trend in terms of our reproduction number. And this is the number that basically indicates how fast the pandemic is growing in the state. And we're currently sitting at about 0.85. And this was the estimate that we had as of the 28th. So the data are a few days old. But if you've been tracking on our website or our dashboard, we do continue to be on this downward trend in terms of the number of new cases that we're seeing in the state. And in terms of where the counties are sitting, overall, we've seen a decline in over 50% of the counties. Currently, I believe over 40% of our counties are actually under that RT value of 1. And that includes some of our larger counties, or at least the counties that really have heavily contributed to the statewide numbers, such as Grand Forks, Cass, Burleigh, and Ward County. So that's great news that we're seeing the trend, not just in our bigger areas, but also statewide, as you would expect. The counties that we are seeing to be a bit of an anomaly are Renville, Sioux County, and Golden Valley, and those seem to have the highest RT values this week, and they're sitting between 1.1 and about 1.2. And then compared to last week, this is the percent change in terms of the RT value. And really, just for context, when you look at the scale here, the y-axis, we're really talking about very small absolute numbers. And so while a 6.9% increase may sound, outrageous, overall, it's not that high of an increase, but we are seeing increases in the RT value in Ramsey, Bowman, Sioux County, Adams, and a few others. But overall, the general trend that we're seeing is either no change or really a decline in that reproduction number. And then in terms of our top 6 counties for the last week, so for current hospitalizations, the good news is for where you're seeing the highest proportion of cases hospitalized, and that's that first column. So you have Logan, Sheridan, Kidder, McIntosh, Golden Valley, and Emmons. Those are the counties that have over 17% of their currently active cases being hospitalized. The good news here it being that, these are some of our smaller counties, but we still do see some higher hospitalization rates in, of course, the ones that I just listed. Our 14-day rolling positivity, which is this middle column, there are a few counties that have quite high positivity, and that's who is listed here, the top 6. And usually when you see a high positivity, what that kind of tends to indicate is there's a lot more disease in that population that what's currently being detected. And so we are keeping an eye on these counties to ensure that, it's not, growing rapidly, and possibly, I'm not exactly sure if, there are issues with compliance with the current orders, or if there are outbreaks in some facilities, but that could be what's happening to really show these high positivity rates. And then the counties, this fourth column, which is the long-term care active cases. So the percent of active cases that are from long-term care. Again, what you do see here are some of the smaller counties in terms of the absolute numbers. But when it comes to the actual case count, you do still see that the long-term care cases, the numbers are highest in the counties with the highest populations. And this last column, rarely changes. You more often than not, what you see is, Cass, Burley, Ward, Grand Forks, Morton, they just kind of go exchange between themselves who's going to be in the top 6. And that's just a function of our population distribution in the state. And so this is just an update to a slide that I think I've shared before. So the only update here would be we closed out the November cases. And so I believe the last time that I talked to this group, we were sitting at about a 3% hospitalization rate. And for November, it looks like it's actually slowing down to be about 2.9%. And so overall, what we're seeing is, basically since March, we've seen this downward trend in terms of the percent of cases being hospitalized. And which is great, especially given the volume of cases that we saw in October and November. And that could have been a problem in terms of overwhelming our healthcare systems. And so when we see this decline, it's actually good news for us that, we're not having as high of our hospitalization rate as we've had in the past. We're also seeing a decline in the average length of stay. So this has also sort of followed a similar pattern. We do have a bit of an anomaly back in September, but for the most part, we are seeing, we started out with our cases being hospitalized for an average of about 10.6 days. And that has slowly but surely declined to an average of 6.7 in November for our cases. So that could be a testament to, better therapeutics, better care. And as we learn more about the disease process, I think healthcare providers are also getting better taking care of the COVID patients. And then in terms of the count, I believe, like I said, this is this column in terms of the count of new hospitalizations. So while we did have, a really high number of cases in November that were hospitalized, my hope is as we move into December and with our decline in the active cases that we're probably going to be maybe have better outcomes as we move into December compared to November, both in terms of the percent hospitalized and also in the count of cases being hospitalized. Again, this is just an update. I believe I've shared this slide before and it has not changed much. Really, again, the key thing to note here is our rate of hospitalization, and that's pretty much what I just shared in the last slide. Overall, it's sitting at 3.4, and that's overall, over the course of the pandemic. But as I said, in November, that actually went down to about 2.9. And so if it follows a similar trend, maybe in December, we'll have a lower hospitalization rate compared to what we've had in the past. And then the other key takeaway here is really the highest risk of mortality is in those cases who've been hospitalized. And that's also confounded by age. And so you do see this age effect as you almost this sort of staircase effect where, if you're hospitalized, your risk of mortality is higher, but it's also higher as you get older. And I don't know that that's groundbreaking information to this group. In terms of our projections, so the good news is, and I've shared this before again, but we actually did update our model. So this is not the same model as you saw last 2 weeks. Previously, we updated this this week. And so with our new parameters and basically the new cases that we're observing, we are obviously seeing, again, the blue is what we were projecting to be the number of new cases. This is the projected daily cases. And the orange is the actual cases. So even with an update to the model, we are seeing really better outcomes than what we were projecting, not just before, but also what the model is actually projected to be our outcomes for the state. And the one thing to note is we have had fewer tests conducted in the last week. So this may not necessarily reflect the actual cases in the population, but overall, as a trend, we are seeing that our actual cases are better than our projected cases. And in terms of well, and some of the plausible explanation for that is, I know there is some debate of, do mandates work? I think we can all agree that masking works, but there is some debate on whether mandates work in terms of encouraging masking. And what I'd like to highlight is, so aside from the statewide RT value that I shared, early on in the presentation, we do generate the RT values for each county and the trend of what that looks like over time. And the one thing to keep in mind is Cass County, for example, which has probably been the largest contributor of cases, overall statewide cases in the state. They did have, Fargo had a mask mandate, I believe October 19th was when they had their mask mandate. I believe a few other counties or a few other cities followed shortly after. And these are the cities that have been like some of the largest contributors to our statewide numbers. And I guess I'm happy to report that, what we observed was really this decline prior to even the statewide mandate. And I think that's a strength in terms of, encouraging people to hopefully continue with the trend that we're seeing by keeping up the masking and following the executive orders, because we are seeing a positive impact in terms of the cases, not just at the local level, but also on a statewide level. And Grand Forks was another, the city of Grand Forks did have the mask mandate, I believe, and that shortly followed with a decrease in the reproduction number, and so did Ward County. And then for hospitalizations, so this is our projected current hospitalizations. Our hospitalizations are still a bit high. I believe we have over 300 individuals still hospitalized today. And while the active cases do seem to be declining faster than the hospitalizations, again, that could also be a factor, like I mentioned, of less testing uptake in the last week or so. But my expectation is that, if we do continue on the current trend of, our active cases really dropping, then the hospitalizations should follow that course. And already they are looking much better than what we projected, which was at this point, we should have had over 400 people in the hospital. And that's clearly not the case today. And then this is our fatality projections. Again, an improvement here. And hospitalizations and deaths are, they're the lagging indicators. So even if we stopped testing today, we would still be able to detect how fast the disease is spreading through our population, through our hospitalizations and deaths. And so as we sort of as we move into the holidays, I think there's some anxiety about what people did over Thanksgiving and whether that's going to influence our active cases. And we're not going to really observe that outcome until about 16 days after that holiday. But in the meantime, I believe hospitalizations and the active deaths are really kind of like showing a bit of an improvement compared to what we would have seen if we had just continued on the trend that we were going on prior to the mandate. And these are just updates to what's happening to our neighbors. So another, with North Dakota, it looks positive. It looks like we're on a bit of a decline. Montana is still struggling a bit with an increase in cases, and Minnesota, I believe, has actually taken over the spot for being the #1 state in terms of new cases. And so, and South Dakota is just, a lot is happening in South Dakota. And so in terms of just the number of cases. And so while we may be doing great, I believe most of your facilities do cross state lines in terms of where you serve your patients and clientele. And so we definitely want to keep in mind that, our neighboring states may not be doing as great as we are currently. So it's almost more of an incentive to keep doing what we're doing to keep our numbers low so we can be able to take care of the patients that are in North Dakota. And this information, this slide just basically reiterates what I just said, which is we are on that declining trend, but Minnesota and South Dakota are pretty much going in the opposite direction, and that may have an influence in terms of our hospital capacity in North Dakota hospitals. And that's all I have, Tim, and I'll stick around for any questions. Thank you.
Thank you so much, Grace. Very informative as always. Well, let me give you a high-level overview about where we're going with the surge staffing. As many of you know, we began taking in some additional staff from two sources in the last couple of weeks. We had a request for Department of Defense staffing, and then we also began working with an out-of-state traveling nurse agency, and that process has yielded, as of today, 136 nurses that are now functioning in North Dakota that have physically arrived and been distributed to various settings. And those settings, the majority of those are to the tertiary care centers, the large 6 hospitals in the 4 biggest cities. And there are 92 of the 136 that have been deployed to those locations. There are 6 currently that are serving in critical access hospitals, and the rest are functioning in long-term care facilities. Now, our goal is to increase that to 260. Originally, we thought that we would be able to achieve that by Wednesday, next week, Wednesday. And so that would mean another 126 nurses coming in from the traveling nurse contract that we have. And so while I don't know whether we'll hit that mark by Wednesday, that still is the plan for us to continue to onboard additional nurses into the state until we achieve that level. And so that process is continuing to be executed, and I'll bring you more information about that as that continues to progress. In terms of long-term care or critical access hospitals or the 6 tertiary care centers, if you have staffing needs that have not been indicated to the state yet, please don't hesitate to contact the VP3 team for long-term care or the Department Operations Center, and those 2 entities will work together to attempt to meet the staffing needs. And speaking of the VP3 team, let's see if anyone is available to us from the VP3 team, either Jan or Seth or Roseanne.
Yes, this is Roseanne, and I am on today. And just a couple of things. It was nice to hear Grace's report, and once again, it supports some of the things that we're seeing happen as well. So, for example, 3 weeks ago, we had 1,500 active cases of COVID in our long-term care facilities. That was either resident or staff. 1,500 cases. As of today, we're at a little over 700. So in 3 weeks' time, it's half of the amount of active cases. So again, a good thing there. We also, for the first time last week, saw our map change in a positive way. In other words, starting in September, when CMS said that all nursing facilities have to test according to the weekly positivity rate, we built a map just for that so that we could weekly see what the weekly positivity rate was for each county. And last week, we've seen it increase since the middle of September. And last week, we saw actually more counties change and go either to a yellow or green status. And then already this week, there is a significant improvement again. So we're really happy to see it, going the right direction. And it supports all of what Grace just brought up on the data that she has. So it's starting to trend down, if only it stays that way. And then just to mention too, we have daily huddles with the 6 tertiary hospitals where they go through their census numbers, and it's very quick. It's like a 10-15 minute meeting a day. The CEOs or the CNOs or COOs are the ones that are, or the chief medical officers are the ones in attendance, and really just touch base to go through every single one of those numbers that we think are important. And that is like the COVID med-surg type patients, the COVID ICU. Do they have individuals waiting? Were they able to accept all of the critical access transfers that were needed. Those are the kind of things we think are important touch points every single day. So with that being said, this week we've had a few of the hospital CEOs suggest that they felt like things were stabilized. We've been only doing this for about 3 weeks, and they felt like there was some stability in the numbers that they were seeing. There was a spike in, I think it was in Fargo on one of the days this week, had an increase in the COVID number of admits. And, that maybe just kind of is trending right with exactly what Grace said, that Minnesota and South Dakota have increases, which could cause surge increases in our hospitals. But again, that would mainly affect the Fargo ones if they, were obviously the tertiary care for many of those rural places. So that makes sense after hearing that today. And then finally, many of you should already know, but the Essentia is taking on we call it a one call, but it's really a secondary call. It's really another opportunity for a critical access facility to make a call to a one call to help transfer a patient that maybe needs a tertiary placement. And again, I think Nicole and her team from Essentia are volunteered to take the lead on that. They were going to be providing education to the critical access facilities, and I think that's been done. But again, we are, if it doesn't get used very much, I think that's a very good thing. That means that we don't have that many residents or family or patients that need to be transferred out. So I think that would be the end of my report. And if you ever have questions, you can give one of us a call and we'll try and answer them for you. Thank you, Tim.
Thanks, Roseanne. Let's go ahead and Ryan, if you're on, could you go ahead and start the slides? We'll collect the survey information. And in the meantime, while that's running, if Ryan is able to get that started, we'll just go ahead and head around the state and see what comments or questions folks have. So let's head over to the Fargo area first and see what comments or questions folks have from the Fargo area. Not hearing any. Let's go to the Jamestown area. And now the Bismarck area. And the Dickinson area. We're up to Williston. And now Minot. Devil's Lake. And finally Grand Forks. All right, we made it around the state. Let's see if anybody has any last minute questions or comments before we go to Tim Blasel for his closing comments. Anyone else before we end?
Hi, Tim. This is Cody. Can you hear me?
Hey, Cody. Yes, we can hear you.
Yes. Okay. Perfect. I just want to. I don't have my turn my camera on. Okay. So just today, I received a critical request for data from HHS. I've already emailed all the hospitals, but they are wanting antibody inventory data by the end of today. And so if anyone listening hasn't gotten those numbers or didn't receive my email for any reason, if you've gotten antibodies to use for us therapies in the past 2 weeks, they want you to submit their data today. So reach out to me if you haven't, but there's only 4 questions. I've gotten quite a few back already, but there's still quite a few that I'm still waiting on.
Great, Cody. Thank you so much for checking in with us and sharing that information. On another matter, I know that we're occasionally having facilities that are not submitting data, and would you just share with us once again the importance of sharing that data, because we're going through a process with the federal government where there's actually a progressive, for lack of a better word, discipline that CMS reimbursement could actually be lost as a result of failing to submit data. Could you just touch bases on that once again?
Yeah, sure. Sure, Tim. So just this week, I received a summary report on the hospitals that have received either first or second enforcement letters, meaning if the hospital has failed to submit 100% in the last several weeks, they received these enforcement letters. And so the last round just went out, I believe on Monday or somewhere around there. So hospitals, I believe, have 3 weeks to improve reporting before they receive the follow-up enforcement letter. But there are 3 enforcement letters that hospitals have to improve reporting before they potentially lose CMS funding. There is a process that you can argue against that ruling or noncompliance ruling. But so if anyone has any questions about that, I can forward the guidance that they provided me. But at this point, it's not very many. And for the few hospitals that have struggled, it was really more of an issue with either it not saving correctly in HC standard. And so there is a process to look to make sure that when you save your data, that you check the modified date to make sure that everything's saved correctly. So if anyone has any questions about that, obviously get a hold of me or Ryan. But also, a few hospitals just kind of forget they're busy, very, very busy. And so that 3 p.m. Deadline to get everything submitted is sometimes hard to meet. So if anyone is struggling with that, let me know. HHS is very interested to know how we can help and what the issues are with reporting. And so as long as everyone gets their stuff in by 3 p.m. each day, they should not receive any further enforcement letters. And as long as they, for the few that have struggled, turn it around today, keep reporting on time, don't leave any questions blank, you shouldn't have any problems going forward.
Thank you, Cody, for that information and also for your help with this. Again, that's a federal process, and Cody's with the State Health Department. We're just here to help. The enforcement action comes from the feds, not from us, but we want to try and assist you in any way that we can to make sure that doesn't become an issue or a problem. Let me see if anybody else has any other comments or observations before we turn it over to Tim. Tim, do you have any closing comments?
Yeah, just to follow up to what Cody was talking about, one of my concerns right now, if some of the, again, if it's a handful of hospitals that are not submitting, again, obviously not receiving CMS funding is concerning. So, Cody, I don't know if we have all of the, again, all hospitals on this call. Hopefully we have a majority. But again, I would be willing to help, obviously notify those hospitals and to discuss the importance of submitting that data. Because, the last thing we want is for them not to receive any CMS funding. So again, I'm concerned that maybe some of those hospitals on your list might not be on this call. So if you've reached out and you're not getting any feedback, let's work together on that.
Perfect. I know that I try every day to look at like 2:30 to make sure those that haven't already submitted an HE standard, I send them a kind of like a warning or a friendly reminder, get your stuff in by 3. And then for those that do happen to miss that day, I do let them know afterwards if they had missed their reporting. But I mean, overall, I think everyone's doing really great.
Okay. Great.
All right. Anything else, Tim?
No, I think that's it. I know I had to take a call during this call, and I think I overheard you talk a little bit about staffing and probably the nurses and working with the eminent group. So I think, both you and I just continue to work on that and trying to bring RNs into the state to build bed capacity.
Sounds good. Well, thank you, Tim, and thank you to everyone that's watching today, and have a great weekend. If you're not working this weekend, we'll be together once again on Monday at 2 o'clock. Take care, everyone.
Yep. Thanks, Tim.